at the South Florida Hispanic Chamber of Commerce's Fashionably Pink Breast Cancer Awareness Lunch and Panel Discussion, which we've been doing for 8 years. And we have had the pleasure of having Dr. Kalos for 3 years. And today she's back with us, and she's going to be talking about a new procedure that it's called the Contrast Enhanced Digital Mammography. So this is something new, and I want her to speak about it briefly so that our members in the community are aware of this fantastic, innovative machine or whatever it is.
It's procedure, you know. This contrast enhanced digital mammography is a mammogram that we inject contrast like the CAT scan contrast in the patient's vein. Then we do a mammogram, and the computer in our machine, the software, subtract the dense breast tissue from the contrast, and we see the contrast. And the cancer has little vessels, and the contrast goes to the vessel. And when we don't have the density of the breast, we can see very well. Therefore, the sensitivity is very close to the MRI, and patient tolerates so much better.
Well, a couple of things. Number one, it's a great honor because as a primary care clinician, we oversee so many patients. We have over 110 offices across the United States, and we have over 500 breast cancer survivors and over 1,053 that were currently in active treatment. So it is a significant part of what we do in primary care, the diagnosis, the management, and the screening and surveillance afterwards. So it's a great honor to be here to share this information to our public that we as primary care doctors are in it for you to help reduce your risk, to help increase your survivability. And I'm going to share some data with the audience about published evidence about why seeing your primary care provider is really important. So it's a great honor to be here with you.
Notable will highlight the indomitable spirit and strength South Floridians and recent transplants bring to the workforce.
We celebrate our bilingualism. As a friend of mine, Jose Diaz-Galar, always says, hashtag, we are bilingual.
For the community, I'm here. Thank you.
Tell me about your life story first, and then we'll talk about your creations and how did you get in the world of fashion. But tell me about your young years.
It all started with sneakers. So I was a real big sneaker fan, and my parents did not like it, especially my mom. So,
oh, you're Cuban, so
right?
Your mom is Cuban.
Right?
Cubans don't like sneakers.
Right, so every time I would make any type of money, I would buy sneakers, and eventually in my room, when you walk in my room, all you would see is sneakers, sneakers, sneakers. So that got me into a lot of trouble. So by the time I got out of high school, I started designing my own clothes to stand out from other people, because I had a learning disability. So I didn't know how to read until I was in 10th grade.
You were hyper.
Yeah, hyper. I had everything.
I could tell. ADD.
They labeled me everything that you could think.
Because he's talented.
EH, SCD, you name it. So I didn't really like school because going to school was really hard for me. I didn't know how to read, couldn't communicate, and I was in special classes. So what helped me was fashion, because they wouldn't pick on you if you dressed right and you wore the hottest clothes.
You were cool.
I was super cool.
Sometimes we try to do together in a setting.
Little vessels that called new stars.
Even nipple sensitivity. Yes, you heard it right. That's
And we make the diagnosis because of routine management.